good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Mark Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Travis Gales, our Health Officer, and also MCPS Interim Superintendent, Dr. Monifa McKnight. Thank you for joining us this afternoon. Reporters, you should all have permission to record. If you do not, use the chat to request it. And with that, the floor is open to you, Mr. County Executive.
So good afternoon, everybody, and thank you for joining us again for our weekly press briefing. This week, I'm happy to be joined by Dr. Monifa McKnight, and I'm really pleased to welcome back Dr. Gales to our media briefing. As I mentioned last week, I am very sad to see Dr. Gales departing, but I'm so thankful for his leadership and advice and service to our county. When you look at the numbers of Montgomery County compared to the rest of the state and jurisdictions across the country, his leadership and the role he played in seeing to it that we did the right things is, I think, a testimony to those results. He really played a critical role in this. So going on with the COVID and the vax rates, today our test positivity rate is 3.32%, and we've got a case rate of 13.37 per 100,000. We had 141 new cases yesterday, so if you all remember, it wasn't all that long ago, and then we were, in single-digit cases a day. So that gives you an idea of the magnitude of the change that has occurred. Most of those cases are among the unvaccinated, but the issue of breakthrough cases is real. It does happen. They don't get sick because the virus is just randomly floating around out there. They get sick because basically the unvaccinated people are making both vaccinated and unvaccinated people sick. Hospital utilization continues to be stable without reaching a peak level utilization. That's good news. We remain a community with substantial transmission of the virus, according to the CDC. That means indoor mask mandates remains in effect in Montgomery County. And, we know the Delta variant is at least twice as contagious as the previous variant that was circulating. I think we've already surpassed the peak of, the second phase. So we're having a fair number of cases now. Scientists from MIT found that individuals infected with Delta are testing positive earlier and are more infectious by the time their infections are detectable. And just this morning, I had to get a COVID test because I was notified that there were cases reported from last week's Maryland Association of Counties conference. I'm vaccinated, I feel fine, but I'm aware that I can still be a carrier, I can still be infected. And this is what we all need to do when we've been exposed, even if you're vaccinated. I'm happy to report that my test was negative. So that is a relief, no mistaking that. And Mako was very 50-50 on who was masked indoors and who wasn't. And the fact that the outbreak may have occurred is no surprise to anyone. A number of us were, disappointed that Mako decided not to require masking. And we know that a number of people who normally would have attended the conference, particularly adults with children, decided not to attend the conference because they don't want to either risk making their children sick by bringing them with them or taking the chance of getting an infection and going home and bringing it to their kids at home. So while it was an interesting conference, and I'd say, I had a lot of useful discussions, it's a good example about why we're following CDC guidance and mandating indoor mask wearing. And while we're in a category of substantial transmission, our rates compared to the Eastern Shore totally justify what we do. Additionally, this is a reminder for everyone that's been traveling on vacation and returning to the county. You need to be mindful of your health, and getting tested is still very important. If you've been out of this state and visited other states where the rate of transmission is high, and you've gone to a restaurant or done public activities outside, or maybe relaxed and didn't have your mask on, it would be wise to get tested when you come back here. As far as our vaccination rates, our total population is vaccinated at a rate of 72.7%. That's fully vaccinated. 80.2% has had at least one dose. You need to remember that the total population includes everyone under 12 who cannot be vaccinated. For those over 12, 85.6 are fully vaccinated and 94.5 have had at least one dose. That is pretty phenomenal. And it makes me optimistic, continue to be optimistic about the residents of Montgomery County. And hopefully the people who got their first shots will get their second shots. And it would just be amazing if we had a population over 12 that was 95% vaccinated. For those over 65, 94.3% are fully vaccinated and 99.9% have at least one dose. Again, that means there is no group of people in that age group who is avoiding the vaccine. Not Republicans, not Democrats, no demographic is avoiding the vaccine in that age group. And well, they should, because they are the ones most vulnerable and most likely to die from this disease. Earlier this week, the Food and Drug Administration granted full approval to Pfizer's COVID-19 vaccine for people 16 and older, making it the first to move beyond emergency use status in the United States. The vaccine continues to be authorized for emergency use for children between 12 and 15, while Pfizer continues to collect data in order to facilitate a full approval. A decision about whether to vaccinate children under the age of 12 is still likely a couple of months away. I'm hoping that all this news will encourage people who have not been vaccinated to get their shot. If your excuse was you didn't want to take an experimental vaccine, that excuse is gone. So now you've got a fully approved vaccine. So if that's what you're waiting for, please come and take advantage of it. I also hope that more companies, organizations, and public entities will require employees to be vaccinated or get regularly tested. There is no reason for that not to be a requirement. Your employees who have been vaccinated and the families they have at home deserve to be safe. Customers coming into your building deserve to be safe. So doing this is an important step to accomplishing that. Like I said before, the unvaccinated are making both vaccinated and unvaccinated people sick. And this is something that we can put an end to. It's a solvable problem, and it's the unvaccinated people who stand as the largest obstacles to our path back to normal. I know when I go out that even though venues like restaurants are open, they are not back to pre-COVID sales. And when I talk to people about what they will or won't do, going to restaurants indoors is one thing where people express hesitancy because being unmasked, which is a consequence of eating, there's no way to know whether or not the people around you have been vaccinated or tested. I see theaters and restaurants increasingly requiring people to provide proof of vaccination or recent tests within 72 hours to gain admission. And I hope that all businesses that have either large crowds or situations like restaurants will mandate that requirement for testing or vaccination as a condition of admission. Increasing customer confidence in the safety of our different businesses will help get people to return to activities they would like to resume. With almost 95% of our over 12 population having one dose and 86% having two doses, the number of people who may not be able to enter is small, while the number of people who could enter your business if they felt safe is very large. These requirements are good for business and good for the community. People want to go out and have fun, but they want to do it without anxiety. And knowing that the people around you are vaccinated or tested would reduce that anxiety. Patronizing establishments that require proof will encourage others to do so. And the less places the unvaccinated can go, frankly, without being regularly tested, will be an incentive for them to get vaccinated. We need to get to 80 to 85% fully vaccinated population to be able to combat this virus and its mutations successfully. No one's saying we're going to make it all go away, but this can certainly be controlled, and we'll likely be one of the communities that's going to achieve that goal. But if the rest of our state and nation can't get there and we max out at 70 to 75% fully vaccinated, including third shots and boosters, we better get prepared to live with this virus for a while. And having eternal vigilance regarding it is going to be essential. That is why I keep supporting and wanting to see more businesses require vaccines and proof of testing. On a similar front, regarding Montgomery County employees, I'm proud to announce that today, following this thoughtful discussions with our labor partners, Montgomery County employees will be notified today that they have to submit their documentation by September 18th, that they've been vaccinated, or they will be required to undergo regular COVID testing and proof of results. I'm appreciative of the hard work and diligence all parties involved to ensure that we do this correctly to protect the rights and privacy of our workers, as well as the health and safety of all our employees and the public we serve. On a up note, school begins next week. Next week, the 2020-21-22 school year kicks off. This is an exciting time for students, teachers, and staff of MCPS and all the schools throughout Montgomery County. After nearly a year and a half of school being online or hybrid, 5-day week in-class instruction returns. Our students need this return to the classroom in order to learn and grow with their peers. As a former teacher, I can only imagine how difficult it was to teach remotely over the last year and a half, and particularly those of us who worked in the elementary schools to teach remotely with kids in that age. That's just extraordinarily difficult. And I think everybody knows that they will get better outcomes. It'll be better for everybody's health if we can manage going back to school. It's not going to be easy. We have to be ready to face challenges from COVID outbreaks. MCPS has worked very hard to create a safe environment for students, as well as having plans for disruptions that may be caused by potential outbreaks. Starting a new job in the middle of a pandemic is very tough, and I think Dr. McKnight is doing a great job during this challenging time. She has been an excellent partner to work with on a range of issues, and I'm looking forward to her leadership here. On the SRO issue, hot topic back in the late winter. It's one issue that we've worked a lot on together over the past several months. During our budget rollout last March, I was unequivocal that SROs were not going to be removed from our school buildings. We're going to be removed from our school buildings, sorry. And despite the many ways people tried to say they were still going to be there, they actually weren't going to be there, and they aren't going to be there. SROs will now be named community engagement officers. They will not be in school as was designated by the SRO program. The school cluster plan will be instituted on Monday, and the community engagement officers will oversee their assigned school cluster and will respond to schools on an as-needed basis or calls for service. MCPS and the county have agreed to an MOU under which community engagement officers will not be stationed on school grounds. School policy issues will not become police issues. School will contact 911 for any issues, not individual officers, and police and schools will meet once a month to discuss ongoing issues. Our next step will be a more in-depth work group feedback that will include a broader range of services and involve other agencies, and that is expected later this week or next week. We do not expect confusion during the first week of school. MCPS had preliminary training with administrators in this process, and I look forward to learning more or hearing more from Dr. McKnight this afternoon, and I thank her again for joining us. Before we turn to Dr. McKnight and our weekly updates from Dr. Gales, there are a couple of other announcements that I want to make. First, we have a new climate change officer. I think with the brutally hot weather and the devastating rains and storms throughout this summer, wildfires out west and in Europe, tropical storms and hurricanes hitting everything from the Caribbean to New England. I can't remember the last time that a hurricane made its first landfall in New England. It's evident that impacts from climate change are happening now. This is real. Like I've said this before, if it weren't for COVID, this would have been the headline of the year. This week, I'm pleased to note that Adriana Hutchberg, currently one of our Assistant Chief Administrative Officers, will now serve as our county's first climate change officer. For the past year, Adriana has spearheaded the development of the county's climate action plan. In her new role as climate change officer, Adriana will lead the county's implementation of this critical plan. There are some things we can do and are doing at the administration level, and there are some things that are going to absolutely require council action. And the things that require council action, if they're not acted upon and not approved, it will be impossible to reach our goals. So I just want to emphasize this. This requires action on both sides of the street here. I respect her commitment to this work and her willingness to serve Montgomery County in this new capacity. And finally, I want to just say that I sent my condolences to the family of Axel Trejos, who was killed near Plumgar Rec Center last Wednesday night. This was a tragedy, another sad shooting, and I want to thank and acknowledge Rock County Regional Center for being on the scene and available to this family and community at such a tough time. The Up County Regional Center helped raise $1,200, which was paid to All Souls Cemetery to assist this family during this very difficult time. Our regional centers are epicenters of outreach and resources to the communities they serve. I encourage all residents and businesses to get to know our staffs in these centers, and please let us know how we can help. And with that, I'll say thank you, and I'll turn it over to Dr. Gales.
Good afternoon and happy Wednesday, everyone. I hope everyone's doing well. A couple of points to highlight before clearing the space for Dr. McKnight. I'm sure she's lots of great updates and we'll be able to answer your questions related to our kids returning back to school. So the first thing to highlight related to COVID management, the county executive discussed where we stand in terms of our community transmission levels, as well as our vaccine rates. Certainly, we do celebrate and are excited to see such high percentages of our population across the county, across demographic groups, getting vaccinated. And we know that we still have room to grow and to get more folks covered, because the more folks that are covered, the more we can get to a new level of a baseline and move forward. As a county executive reference, we have seen an increase in the number of cases, the case rate, and test positivity. But what's encouraging, and quite frankly, what has given me a little bit more ease and comfort, if you will, is that we are not seeing a huge uptick in our hospitalizations as well as fatality rate that accompanied similar increases in cases earlier in the pandemic. Now, certainly we will continue to monitor those trends and make sure that folks are getting tested and have access to testing, as well as increased access to vaccine sites. But this is encouraging news that hopefully will be able to blunt the impact of the Delta variant or any other variants that come. And in reality, this gives us a picture, as again the county executive referenced, of what life will look like post-COVID. We will continue to see COVID cases in the future, but with increased access to vaccines, as you referenced, one has been FDA fully approved, and we anticipate others will come on board for full approval within the near future. And hopefully access to the vaccine for our younger folks, where we will see cases much like we see flu cases each year, but we won't see a high number of folks impacted negatively in terms of having to go to the hospital and certainly require critical care resources, and unfortunately for those, pass away. So we continue to monitor those trends, and we will continue to monitor trends, particularly as it relates to our pediatric population as they return to school. Certainly, we will look at the surveillance data, and if there are any significant changes or sharp changes to that, we will provide the necessary guidance to our leadership in the public school system as well as the non-public school system in terms of the public health recommendations we would have to mitigate transmission of cases as much as possible. And it has been a pleasure working with Dr. McKnight, her team, as well as the different leaders throughout the different non-public schools as well as they return to school in terms of providing guidance to keep kids safe. I also wanted to highlight a number of opportunities that have been put forward in terms of additional vaccine pods, working with MCPS. We have 5 different pods that have been scheduled, one today at Kennedy High School, one tomorrow at Albert Einstein, one at Paint Branch High School on Friday, the Shady Grove Bus Depot on next Wednesday, and Watkins Mill High School on September 4th. And these are opportunities for MCPS staff as well as students to be able to utilize to get vaccines before they return to school. We have contingency plans in place to provide vaccines to those who are immunocompromised, and again, making sure we use the right terminology. For those who've been identified as immunocompromised or meeting certain medical conditions, this is considered a third shot. We began providing those doses to individuals who fit that medical criteria on last Friday at the county sites. According to our numbers this morning, we have provided 59 doses to individuals who met that criteria. We also have contingency plans in place to be able to scale up and meet the need or meet part of the need for individuals when we start providing booster shots for any other individuals who meet the criteria of being 8 months post their second shot. And we will be working with our county sites as well as community providers now have open access to vaccines and are able to provide doses to their patients as part of their rosters. So please stay tuned for further details as those opportunities become available. The second thing I'd like to highlight is I've been seeing a lot on social media, the crate challenge. People climbing crates and having disastrous outcomes. Let me be clear, it is not in your best interest to engage in that activity or other types of reckless activities, particularly given the summertime, vacation, and so forth. It's important to, one, just observe good safety, and then recognizing that as much as possible, we can avoid unintentional injuries that could potentially lead to utilizing emergency room resources that could be utilized for other individuals with more serious concerns. So I say that kind of jokingly in terms of seeing what's on social media, but also seriously, just be careful and exercise some common sense in your activities. The last thing I will mention is obviously last week, there was lots of comments related to the letter, my resignation letter that was submitted. As the county executive referenced, I was on vacation and not available for comment. And given that we have lots of issues to talk about today, I would be happy to discuss that in further detail following the press briefing. We've been focused this week on making sure our transition plan is in place and as seamless as possible. And let me be unequivocally clear, we have a phenomenal, fantastic, bright, brilliant team within public health services and health and human services and other arms of the government who will continue to execute the work that we have put into place over the last 18 to 20 months. I have no pause or concerns about the team's ability to do so, and it has been an extreme honor and a privilege to work alongside with them in partnership over this last year and a half and working with our community residents to keep them safe. I also want to say something related to working with the county executive and listening to some of the transcripts last week and reading some of the news articles. I personally appreciate significantly the opportunity to work with an elected official who has not been afraid to listen to science and clinical advice. I know that my fellow colleagues in other parts of the state, the region, and the country have not had that opportunity. And I want to publicly thank him for giving the space to allow for those messages to be heard, to help advise policy and advocate for those policies, because there have been a number of times where we have moved against the grain. We have caught a lot of flack and stress for that, but the data has proven that those decisions have helped keep folks safe, which is ultimately, at the end of the day, the goal that all of us have had throughout the pandemic. I will be pivoting and transitioning to a next chapter and a new chapter, which will be announced by the end of the week. So I can't go into great detail about that today, other than to say that it is an opportunity that will allow me to continue to be committed to what I have tried to move through my career focused on, which is improving access to care and closing gaps in health outcomes for all members of our community, particularly those who are most vulnerable. So thank you again. I'm sure we'll talk. We still have a couple more. You're still stuck with me for a couple more weeks. And I look forward to continuing the conversation and working with you all to get the word out. Thank you.
Thank you, Dr. Gales. Thank you, Mr. County Executive. Superintendent Dr. McKnight, your turn now for opening remarks.
Thank you so much. So good afternoon, everyone. It's so great to be here. I'll start by saying I want to give thanks to our county executive and our county health leaders for their partnership, just supporting opening of school in this 2021 school year, which is really important to us as we think about all that we've gone through together over the past year. As Dr. Gales was just speaking about the benefit of being in a county in which we have put safe and health first, the school system has definitely benefited from that, so I am deeply appreciative for it. And I do want to take this opportunity to publicly thank Dr. Gales for his collaboration throughout the pandemic to ensure that we were able to meet the needs of our students and staff in the conditions that we were in. He has had a very difficult job, I must say, and I think we've all had a front row seat to that, but I'm grateful for his hard work and commitment to safety, because the school system, as I said before, has absolutely benefited from that. So thank you, Dr. Gales. We appreciate you, and we look forward to continuing to work with the staff who've been a part of all these collaboration efforts up to this point in the future. So talking about the first day of school, it is exciting and continues to be exciting for us here in Montgomery County Public Schools. On Monday, August 30th, we are prepared to welcome nearly 160,000 students back into our school system, 24,000 staff members who are coming back into our buildings to support in-person learning 5 days a week. And I stress that because this is a very different place from where we were last year in opening of school. And this is something that many of us we've been anticipating this for a while since the pandemic. When can we actually come back into some of our traditions? And here we are now. But we're not all the way there, and we'll talk more about that as we go through this briefing. However, we have been preparing all summer for this day, and we're excited that it's finally here the week before. This week, we're welcoming our staff into the buildings for pre-service. Our teachers who are joining us in the virtual academy, they're preparing and talking about ways in which they're going to be able to engage students on the first day in a very comforting and supporting way, although it's through a virtual environment. So this week, we are here together, and all of our staff are building community around how we're going to physically, virtually be prepared to greet our students and welcome them back on the first day of school. So just to talk a little bit about the past 18 months, our teachers, administrators, and staff, they have done an amazing job. We've learned so many valuable lessons from them as they have navigated through the pandemic, and in quite a number of ways shown us new and improved ways to improve our public school system. And it doesn't just start with our staff, our families, also parents, our community members. They've also rallied around to help us continue to think about ways that we can provide learning opportunities for our students, and how we safely do that has been a part of the conversation even more now over the past year. And then our students, I have to say that they have shown incredible resilience and determination in this process. It's been in a lot of ways very disruptive for them and became a new normal overnight. But again, I always point out to us, our students are more resilient sometimes than we think. And they have also been a part of having us consider ways that we go about our work and ways in which we support their education. That's been really helpful in preparing for this year. So now it's time for us to take that step into, I'll call it the new normal. And I call it the new normal because it wouldn't be exactly what it was prior to the pandemic, as it should not be. And all the lessons that we've learned over the past year should be moved forward to frame new and better ways that we're able to provide an educational structure for our students. We know that the vast majority of our students will be more successful and more engaged if they're in a classroom every day. That's a fact. We know that. So our goal is to open our schools on time and to keep them open. Last night, I talked about this at our board meeting, but that means we have to take a number of steps. And so we have to consider, as we think about our traditions and come back into the school year, how do we protect those spaces in which our students and staff will accommodate every day to make sure those spaces are safe and they are protected for those who will live in those spaces essentially over this next year. So it certainly is not business as usual in that way, but our students have been through an extremely trying time, and many of them coming back this year in our schools, they need that academic, social, and emotional support there. And we have to recover what learning has been lost during the pandemic. And so as we think about all the ways in which we have to protect that environment, it does mean that we need to take some different measures. And so last night I talked about we're pivoting our back to school nights this year. We are making them virtual. Yes, we were excited to welcome parents and families back into our buildings this year. But right now, considering all of the science and the fact that we're managing the Delta variant, we know that we can still connect with our families in a virtual environment and in a meaningful way and in outdoor spaces when it's appropriate and when we can. And so that's what we will do to make sure we're accomplishing two things: still connecting with our community and doing it in the most safe ways and taking the lessons that we've learned over the past year of how to do that. So we will be deliberating and understanding what each of our students need and provide the time and resources and services that will help them thrive as they come back into our school buildings this year. We want to rebuild those relationships in and around the school that were lost during the pandemic, but most importantly, focus on our student success and in their future. And so as they come back into the folds of our school system, how do we do that has been a pivotal point of our discussion. What does it look like in the classroom? How we welcome them back? How we engage them back into activities that really does support their social emotional learning and their connection to peers. So as our students return to our school buildings with the pandemic still going on and the Delta variant leading spikes in COVID-19 cases, we will continue to follow national, state, and local health protocols in implementing these procedures to keep our students and staff safe and to maintain a healthy environment in our schools and contribute our part to stopping the spread of COVID-19 in our schools. And to even talk more specifically about how we're doing that, I'll point out a few things that we are doing, and much of it was discussed in our board meeting yesterday, but I'll highlight a few. One, requiring our staff to be fully vaccinated or submit to weekly COVID-19 testing is a step in that direction. We want our staff vaccinated, as well as our students who have a vaccination available to them. Second, we are requiring masks for everyone in our facilities, regardless of vaccination status. We have learned, we have experienced that wearing masks is a way to mitigate disruption in the spread of COVID-19. And so we've made that commitment as a school system. We're following strict cleaning and ventilation processes in our schools. Next, we are maximizing the use of outdoor spaces for lunch and learning experiences. And I'll say that I am all for outdoor lunch. Any opportunity that I get these days, small little things that we didn't think about before, to step outside for just a moment of mental break is good. And so if it's good for us as adults, we know it's necessary for kids. Have always been good for kids. And so we definitely are doing that. We are encouraging and making use of our outdoor spaces for that purpose specifically. Now, with that said, we also have to make sure that we're doing this safely and with supervision and making sure that we're taking space consideration into the process of this. And every principal has to do that thoughtfully and with the leadership of their community, because we do have 209 schools. And so how we, again, consider how do we create these outdoor spaces to be safe? How do we make sure that they're supervised? And how do we take the space that's available into consideration has to be one that's pointed out, because it will say that the use of outdoor spaces will look different in different schools. So I wanted to point that out, but definitely looking forward to all of our schools looking at their outdoor spaces and making that commitment to use spaces that they have not in the past, rediscover spaces that just they didn't know were known prior to the pandemic that could and would be used, and how the school system will be able to support that. So again, I want to say that our principals have been magnificent in that way in terms of being truly creative and innovative in how we maximize those spaces and how we embrace that given the circumstances and beyond. As I shared earlier, this is just a good practice. And then finally, I know there's another really important part that we will do this year that I'd like to point out to our community. And that is that we will frequently and clearly communicate with our staff, our parents, and our students about what's happening in schools. So I first say it's important to do that because we have to acknowledge that during COVID-19, as we've managed this pandemic, we've learned that it's impacted every family in a different way. And that has to be considered. And now with the Delta variant here on our heels, we have to also think about how that has created some new emerging concerns for our families. And so communication is key. So as we manage COVID-19, we're going to do the following as we think about communication. I want to say that we are going to isolate employees and students to ensure that they are tested and quarantine is used at the appropriate time. We're going to notify the school community, including reaching out to our students and staff who may have had prolonged contact with affected persons, and make sure that they get tested, quarantined, following all of those protocols. And most importantly, we're also going to, in the midst of all this, continue learning for students who have been directly affected in the entire school community. And we talked about that last night in our board meeting. So making sure that our students who are quarantined have the opportunity and will have access to learning is absolutely one of our priorities. So with that said, this is what we're doing in the school system. What we've learned about the pandemic is that everybody has a part in how they contribute to the successful implementation of how we keep our buildings safe, our schools safe, our community safe. So in turn, we're asking our students, staff, and families to do their part. And here's what we're asking. Please get vaccinated if you can. Dr. Gales mentioned a number of pods and clinics that we've set up around the county for our staff and students, and our communities have been really big in participating in those clinics from the spring throughout this entire summer. We're continuing to set them up and be intentional about setting them up in spaces so that location, means of accessing them is not a difficult area for our families. So please, if you can get vaccinated, please do your part in helping our community by doing so. We also ask that everyone wear a mask in our school buildings and in our indoor spaces. That's also very important. And so we know for different reasons, we may have people who must make contact with our school buildings. When you do come to our school buildings, we ask that you wear a mask when it's necessary to come. And if students or staff are not feeling well, we are asking you to stay at home. And then finally, most importantly, if a staff or student member has or may have COVID-19, get tested and let the school or staff supervisor know as soon as possible. In this way, it allows us to keep our community informed and conduct contact tracing to limit the spread. So we do depend on communication from our community so that we can then implement the practices to make sure that we're keeping our schools safe. So we know that this is not realistic to make guarantees regarding COVID-19. So when cases do arise, I want to stress that MCPS is prepared to respond. While our focus is 5 days a week of in-person instruction, we also know how important it is for the system to be able to quickly and effectively pivot to a different instructional model should the state, county direct us to do so because of changing health conditions. And so by working together with our county government and our community partners, staff, students, and families, we can focus the school year where it needs to be. And that always has to be meeting the needs of our students and preparing them for the future. And that is what we have to stay focused on. So thank you so much. That covers my comments and updates from Montgomery County Public Schools.
Thank you, Dr. McKnight. And let's get started with the Q&A portion of this presentation. Aisha Khan, Fox 5, you're first. You have some questions, I believe.
Yes. Hi. Good afternoon. So I did want to start mentioning with the recent situation at QO with several people who tested positive, which obviously caused the shutdown of the football program. But with that said, just I know Dr. McKnight, you just talked about it, and Dr. Gills, you talked as well about the plans you all have in place. I just want to know any idea on when and how you plan to put such contingency plans into place. The other question I wanted to ask, this might be Mark's answer, but what's the latest on maybe hiring a new health officer? Whoever wants to go first.
I can begin. I'm already off mute. So at this time, we are aware that we had 26 positive cases of COVID-19 at Quince Orchard High School. The majority of these cases did involve the varsity football team. So Quince Orchard High School, in collaboration with MCPS Central Office and the Department of Health and Human Services, we have worked swiftly to address this evolving situation. And in doing that, we paused the football practices and activities while contact tracing was underway so that we could truly understand what this condition was, how we could prevent the spread. So with that said, practices did resume on Monday, August 23rd for fully vaccinated and asymptomatic players. All other players will resume practices after they have completed the 10-day quarantine. So just to give you an example, those are the protocols that we put in place that we've been working on the entire time, anticipating that cases like this would arise. I also want to say that I am recommending to our families, to our students, if you are an athlete, please get vaccinated. We are holding vaccination clinics for this purpose. We are, again, making it manageable so that students will have it easily accessible to them. But this is really important because we also acknowledge that our extracurricular activities are meaningful. We know many of them sometimes involve high contact. And so when we know those are the conditions, then we have to do our part again to make sure we're creating the most safe condition. And right now, that is being vaccinated to prevent very hospitalization and very severe sicknesses or illnesses. So we symptoms. And so with that said, this is very important to us. The health and safety of our students remain our top priority. And we're going to continue to work with our health partners and with Quince Orchard High School specifically to put those resources and supports in place to address our student athletes and others who may be impacted.
Hi, Aisha. To add to what Dr. McKnight stated, so I just want to remind folks that all of the things she mentioned in terms of the protocols related to identifying cases, identifying close contacts, quarantine, those kind of things are consistent with what we have done in the last year and a half. So none of these are new. They are slightly nuanced from maybe last year, given updated recommendations from the CDC related to the term of your isolation period or your quarantine period based upon your vaccine status and your demonstration of symptoms. So none of that is new. Those policies will continue, and the same contact tracing policies that we worked with MCPS as well as our non-public schools last year are the same set of policies that we would put into place and execute as kids go back to school. The other point I want to emphasize is that in relation to the first part of your question is what types of parameters would influence our guidance to the schools to say, further action needs to be taken. Those same principles would be consistent with what we, again, have followed throughout the pandemic, and the same principles that we are guiding whether or not we would need to recommend further action from requiring face coverings or take further action in terms of looking at our hospitalization numbers, fatality rates, severity of illness. And again, recognizing that a substantial portion or maybe half of the pediatric population within the school system is not eligible to be vaccinated. We're keeping a very close eye on the numbers to see how the trend lines go for kids, and particularly not only in the terms of the number of cases, but also the potential severity of illness. We would not, or I would say very clearly, the health officer's office would not hesitate to recommend further action. Again, it's up to the non-public schools and the Board of Education to take those steps per the state regulations and laws. If we started to see an uptick in that number, because we would not want to wait for the numbers to increase significantly or to start to see a lot of hospitalizations before recommending further action.
And to answer your other question about the search, we will begin a search, and that should start pretty shortly. We want to fill this as quickly as possible. I expect other people to apply. I've already been contacted by at least one person who'd like to apply. So we'll do the search. This is, I think it's not solely the county's appointment. We do the search, we come up with candidates, and then we send them to the state. And I had a meeting with the Secretary of Health, and I just made it clear that that what we're looking for is somebody who will be independent and will not give us political advice, but will give us the best medical advice. And that if it means standing up to the governor, who's this person's other boss, that I'm looking for somebody who has the courage to stand up and tell us the right thing to do and not tamper down the right thing to do because of political considerations. I'm not sure he was totally thrilled with that, but I need to be open about it, because there's no way that we would have gotten where we did if we had a health officer who was looking over his shoulder at what the governor wanted him to do. And the governor's not a health official. So I want somebody who has the knowledge and courage of convictions that Dr. Gales is able to demonstrate, so that we don't ever wind up in the situation that's happened across the country, where health officers are afraid to do their job or unable to do their job.
Thank you, Mr. County Executive. Thank you, Aisha. Next set of questions, Dominique Maria Bonesi, WAMU. And I believe you have questions for the County Executive and also for Dr. Gales.
Focusing on County Executive questions first, I was wondering, I know last week you mentioned that you would have some sort of alternative plans for the Cofield Recreation Center and the Long Branch Recreation Center turned into homeless shelters. Do you have any other alternative plans that you've come up with this week that you might be able to share?
We haven't come up with an alternative plan this week. I mean, we know that we're going to have space as early as December or maybe January that will solve all this. We're trying to figure out what we can do if there's something we can do in the interim. I know that they're ramping up the recreational activities at all of these centers. I just want to emphasize that, these centers were equipped to play the role that they played. And our homeless population had an astoundingly low rate of infection because of what we were able to do to keep them sheltered. And we need spaces where we still have to abide by CDC guidance in terms of spacing. And we frankly have problems finding other places. Hotels are not as easy as I want to book 10 rooms. We've had hotels tell us that they won't take homeless people again, or they'd only take a few. I hope but homeless people are adults and they have to be treated like adults. And that can be challenging in some settings, and it can be challenging in terms of what has been the hotel's experience with populations. So it's not as easy as just popping in there and say, I want to get a bunch of hotel rooms, and I don't have a hotel for sale of the size that we'd be looking for. So we continue to look for other solutions. And frankly, I have them looking at more permanent solutions, because when this is all over and I get to next March, people will be put back out on the street unless we find a way to avoid having our homeless population live on the street for 8 months of the year. I find that unacceptable. It's been the county practice since as long as anybody knows. And I'm determined to figure out a way to house people so they do not have to sleep on the streets 8 months out of the year. And that's going to take a little bit of time to line up both locations and how we want to go about building them out. But we are working on that, and we will find both the short term, we'll deal with this in the short term, and we're going to find long-term solutions so that people are appropriately housed and we won't face this kind of issue again.
I wonder if you had any comment regarding this idea that there seems to be a need for more affordable housing in the district, not just for those making 50% or 40% or lower of the medium area income, but also people making less than $40,000 a year, $30,000 a year. Is there some longer term plan? Because I'm hearing that the issue is also that you can't get people out of the shelter fast enough to get them into housing because there's just not enough of it.
Look, their incomes are so low that there's no realistic place to put them in this market. They're not at 30% of AMI. They're not at 20% of AMI. Many of them are lucky if they have incomes at all, maybe close to, area median income. If you were at 10% of area median income, you'd have a $10,000 or $11,000 income. Homeless people don't have $10,000 or $11,000 incomes by and large. So that is a whole separate problem, which is why we're trying to look to see what we can put in place that specifically addresses that population. But on the other hand, it's only, measured in a few hundred people, maybe 400 to 500 individuals, maybe a little bit less than that right now. So that's a very, very different issue. Housing for people between 30 and 50% or 30 and 60% is incredibly scarce. I've tried to make this point before, and people keep, I won't say, and the planning board and others keep either missing it or deliberately avoiding it. But I've got 20,000 households, 30% of AMI, that's about $32,000 income, who cannot find housing. These are not the people in HOC housing with vouchers. These are people with no vouchers and no housing. At a $30,000 income, you can afford $9,000 a year, which is $750 a month, of which there are virtually no apartments. Of the population that they projected to come here over the next 10 years, between 2/3 and 75% of that population would fall into a category of below 60% of area median income. Housing for that group is extraordinarily rare. So we have deep challenges in trying to build affordable housing here. We don't require enough. 12.5% MPDs for people making between 60 and 75% of median income doesn't do anything for people below that. If you up it to a whopping 15%, you're still only looking at 15 units out of every 100. That is 15% of every 100 new units, when I basically need 75% of every 100 new units to be affordable. So that should give you an idea of the magnitude of the challenge and why this is not something you can just make happen. And the county has not been good at this. We have not, over the years, targeted this population. We've watched more of our affordable housing disappear, which is why I do support some form of rent stabilization in the county. We have less affordable housing now than we had 10 years ago and 20 years ago. It doesn't vanish in the air. It just gets converted into expensive housing. So I have a deep and persistent problem that's not going to be solved by simplistic pronouncements by people.
And I'll reserve my question for Dr. Gales at the end of the press conference, if that's okay. Or is this the end of the press conference, Lorna?
No, it's not. Go ahead and do it now, Dominique, so we can move forward with the other reporters.
Dr. Gales, I just wanted to ask, your decision to leave the department, is it because you're accepting a job elsewhere, or is it because this has been a long 20 months for you? I know that this is, I'm sure, I think, County Executive Elrich said it well last week that you've been through hell and back with people comments on social media and such. And I've talked to your colleagues over in Anne Arundel County. They said they've also had threats to their life. So just wondering sort of what was the impetus behind your decision?
Thank you, Dominic, for your question. So two things. The first one is, yes, we've received a lot of backlash for what we've done, but I wouldn't change anything that we've done. I stand proud. I stand proud with our team of everything that we've done. We've had to make tough decisions with limited information, limited resources. And unfortunately, politics has been injected into that discussion, which has made it very difficult for some folks to understand the value of the work that we have done across the board. And again, not just here in Montgomery County, across the state, the region, and the country. And I'm hopeful that if we ever face a pandemic again, or any other significant public health issue, that we won't have to deal with that type of politics and we'll be able to respond together, regardless of demographic group, geographic location, party affiliation, and so forth. Health decisions and scientific decisions and medical decisions are not based upon what are politically popular. And as a public health practitioner, as a clinician, I think of when practicing medicine, when we make decisions based upon the training we have and the knowledge available to make sure that the patient is having the best outcome possible. And that's what we've been asked to do. And that's what I feel strongly we have done over the time. And I'm proud of the work and proud of the work of myself and the team in getting that through. So with that said, certainly, you do get, it's been chronicled, some of the stuff and the feedback we've received, but I quoted in our team meeting the other day, I got the artist wrong. I said it was Katy Perry and they corrected me and said it was Taylor Swift. But shake the haters off, quite frankly. And we will continue to stand on principle and do the work that we've been trained to do. And based upon the expertise we have. Now that said, I was presented with an opportunity, was approached about an opportunity that leveraged my interest and passions, many of which we have put forward in our COVID response and the work that we've been doing in the county, not only in health, but in other areas related to equity, social justice, and access to care. And was presented with just a phenomenal opportunity that, quite frankly, I could not say no to. And I think that once it is, and I'm not trying to be cagey, it's just I'm respecting the entity's announcement to come. But I think once you find out what it is and it's made public, it will make perfect sense. And it's entirely consistent with, again, what I have hoped to have conveyed in terms of my mission and my professional career, which is to improve access for all folks, particularly those who are most vulnerable.
Well, congratulations to you and thank you again.
Thank you.
Thank you, Dr. Gales. Thank you, Dominique. Next set of questions coming from Rebecca Tan, Washington Post, and I believe the questions are for you, Dr. Gales, and also the county executive. Good afternoon, Rebecca.
Thank you. Glad to be back. Congratulations, Dr. Gales. It's been great working with you. I hope wherever you're headed next involves fewer calls and emails from reporters at 11 p.m. On the weekends. Nobody deserves that except elected officials, as you know. So a quick question for County Executive Ulrich. You mentioned that you tested negative after going to Mako. Did any of your other county employees, I know there was a contingent of, I think, 4 of you that went, did the rest of them test negative as well? Sorry, I think you're muted.
Mr. County Executive, can you please unmute? There you go.
So I don't know the results for everybody else. I know that we all just got this happy news this morning or last night. And I did mine, a little while ago, and it only takes 15 minutes. So I got it done. I know at least one other person was getting it done at about the same time, but I haven't heard from everybody and what the results are yet.
Got it. And a quick follow-up question for Dr. McKnight and Dr. Kroll, actually. Students, to do with, the role of police in schools and related issues, students and student activists have called on the county to add social workers, counselors, psychologists to schools. This was a big part of the discussion over removing police from schools. And county officials and the county leaders have promised to do that. I'm curious if you're able to provide any update on what the status of that is, given that the students are headed back to school. Will they be met with expanded mental health resources? And if not, what is the timeline on those resources materializing for students?
Absolutely. I will take that question. So we've been discussing this for a while, and I'll speak specifically about social workers. Prior to the pandemic, we were studying other social work models existing in school systems. And at that point, had already seen, based on our mental health needs and support and wraparound services needed for students in schools, that was a necessity in Montgomery County Public Schools at that time. Of course, the pandemic occurred, and we had a number of other priorities that we needed to pivot to. So we're right back there at a time in which we know it is really important to have additional supports in place for mental health supports and supports for our families. So in our Essa funding, we have put in a commitment to hire 50 social workers to support our schools, and we are pending approval for our Essa funding plans at this point, which should be approved next month. So we are planning and coordinating efforts to begin hiring for those social workers here early in the fall, so that they can be folded into the process of the work that we're doing. And this is a part of the bigger plan that Dr. Cole and I have been working on with the group, the task force, and the county executives group on student well-being, acknowledging that we needed to have these supports in place for our students and families within our schools, making the services easily accessible. So that was one announcement I'm excited to make, and I shared it last night in our Board of Education meeting as well.
Well, the piece that I would add to that is that, as Dr. McKnight references, that we've been working with the schools throughout the summer, throughout the spring and summer to get ready for this fall. And as Dr. McKnight and CPS brings on more social workers, our task is now to make sure that they are coordinated and linked with the existing services that are in operation. We've been working diligently to expand our mobile crisis and outreach teams as part of that effort, but also making sure that we have adequate communications and coordination of responses to schools when incidents arise or when there's a behavioral health need. Our staffing in our crisis center is getting back up to capacity, so that if there are calls and a need for on-site or remote assessments and supports, we'll be ready to provide that support to the school system.
Just to clarify, Dr. McKnight, so as early as this fall, we could see new social workers in schools. Is that right?
So that's our hope. Of course, our process is pending approval from the state on our Essa grant that we submitted the proposal to cover the cost for those 50 additional social workers. So once that is completed, then we will start the process of obtaining the social workers within our school system. We are hoping for early fall.
Thank you both.
Thank you.
Thank you, Rebecca. Next set of questions, Amy Cho, NBC4, and I believe they're for you, Dr. McKnight. Amy?
Hi, thank you so much for taking my question. I appreciate it. I'm wondering, Dr. McKnight, if you could please speak about the ongoing teacher shortage that we've been seeing in Montgomery County Public Schools, as well as throughout the DC area. How many teacher positions you guys still have to fill, how you plan to handle the teacher shortage, For instance, last night we heard that at Wingate Elementary, some students still had not been assigned to a teacher yet, and there was talk of having staff members take over for those classes. But then this morning, the principal announced that they would be expanding class sizes, which we've heard from some parents who are concerned about social distancing, things like that, instability with teachers. So you could please just give some sort of an insight into all these things. That'd be great.
Absolutely. So yes, this is not unusual. Unfortunately, there is not there's a broad teacher shortage, I'll say. And this has been a case that we've been facing nationally and locally for a while. Here, speaking about Montgomery County and where we are in that process, we have a number of large jurisdictions that are right around us, which also we take into consideration what that means every year in terms of our recruitment efforts. So while I will say that there is a broad teacher shortage, we always focus in on the fact that they really only exist in certain areas. And so those are the areas in which we continue to be very creative in our recruitment strategies. Over this past year, even during the pandemic, in many ways, we really had to ask the question, what does require us going through a traditional process of hiring teachers, and then what services, as we're providing needs to students, are ones that we can actually contract out for. And so we're asking been asking those questions and really thinking about that as we prepare. So at this point, we are around roughly close to 300 teachers short. There are always teacher vacancies, as I shared, but we will continue to recruit and provide coverage for our students until all teachers are hired. And because this is something that we face every year, I must say we have a great bank of supporting staff who come in and support. Oftentimes, retired teachers, retired principals who actually want to come in and have shown a commitment to really show up for the school system with all that we've experienced over the past year with the pandemic. So we're hiring all the time, every day, and we'll continue to do so to make sure all of our vacancies are filled, and that most importantly, we have adults prepared to serve our students at the beginning of the school year and throughout the school year.
Thank you, Amy. Next question, Kate repeats Bethesda Beat, also for you, Dr. McKnight.
Hi, good afternoon. Building on the conversation about precautions in schools this fall, I've been kind of doing some research, and when you overlay the maps of where the county's community transmission is the highest, it often aligns with where the most overcrowded schools are in MCPS. So some are anxious or worried that that crowding and then the close proximity that kids, particularly at elementary schools, would be in puts them at an inherently greater risk for COVID infection and transmission. And so as we talk about the number of cases rising, particularly among the unvaccinated, I'm wondering what additional precautions are going to be in place at these schools that are particularly overcrowded.
Thank you, Caitlin. So yes, what you described has been a concern to many of us and our community throughout the entire pandemic. At some point in time, we were at a place in which we talked about physical distancing being a priority. But since then, we've learned a lot. And what we've learned from our medical professionals and others is that it is a priority for us to have our students having an in-person instructional model available to them to make sure that we're supporting their learning. And in addition to that, their social emotional needs. And so that's why we have to continue to focus on how can we safely have our students come into our schools and be able to serve at full capacity. So I'll mention some of the things that I've already mentioned. Wearing masks, using outdoor spaces, being very innovative in that way, even more so now than we haven't before, because using those outdoor spaces actually does allow us flexibility when we think about places that are really full in capacity. And we're also working with individual communities who've communicated. They have concerns and they're sharing their questions and recommendations, which we appreciate, about things that we can do to help them feel safe. And so we're working with those communities particularly, and we've talked about in some cases providing portable classrooms that are outdoors and providing separation where it's necessary in very crowded spaces. But again, using outdoor space and looking at what those needs are for every school individually, and also looking at the capacity and what it means for every school in terms of our current enrollment is exactly what we're doing, because that leads us to the right answer for that school. And again, knowing that the right answer may be different depending on all the circumstances around school, physical space, what types of mitigation steps we've put in place for each school during the spring, and taking that into consideration with where we are now.
I could just add one thing. As Dr. McKnight mentioned, and again, this is a kudos to her team and leadership in the non-public schools as well. They have thought through lots of different iterations of all these different things and have come up with different policies and plans that we've had an opportunity to work with them and provide guidance on. And it's easy to come up with plans in terms of when kids aren't there, and as kids do come back into school, we have every faith and confidence that they will continue to tweak their plans as needed to be able to meet the needs if things arise. The one thing I wanted to highlight, though, and this isn't necessarily directly related to kids being in school, but your question, Caitlin, at least triggered to me a larger piece of the conversation, and kind of gets back to the question that Dominique asked me about, things that have influenced our decisions. We know COVID has taught us, as you referenced, that there's high density, larger numbers of cases come from areas that there's high dense population, issues with housing, issues with affordable access to work, access to transportation. And it just underscores that there's so many things that have influenced COVID outcomes that also significantly influence all of our other health outcomes, those social determinants of health. And it's important as we continue to move forward that that is also a part of the conversation, as much as we talk about testing and vaccination and things like that. And I hope that's not lost. It hasn't been lost here on a local level, and hopefully that continues to be a part of the discussion as we move to a post-COVID space of recovery at the state level as well as the national level.
Thank you, Dr. Garrels. Thank you, Caitlin. Steve Bonnell with Essa Good afternoon. You're next.
Afternoon, everybody. I guess I'll direct this to Dr. Dales first, and then others can jump in. First of all, congrats on wherever you're headed. Maybe it's me. It's tough to track this. I'm maybe not finding it. But as our cases have kind of ticked up locally, do you know percentage-wise how many are breakthrough cases and how many are the Delta variant? Have you been able to kind of hone in on that, and percentage or whatever you can give from a data perspective there?
Sure. Thanks, Steve, for your comments, and thank you for your question. So the answer is yes and no. We have been tracking for some time now the number we've been able to track it with Immunet, and the state has provided data. We've been able to track the percentage of breakthrough cases of those new cases, as well as track those to see, what's ending up in the hospitals. I don't have the PowerPoint in front of, actually, I do, let me stand corrected. I do have the PowerPoint in front of me. When we look at the last 4 weeks, we've had 2,874 cases. Just over 1,000 of those were vaxxed. That represents 0.137% of vaccinated residents testing positive. And when we look at the hospitalizations, of those 2,800 cases, only 115 of them have been hospitalized, which represents 4% of that. And I believe 40 of those were vaccinated. The overwhelming majority of those who were vaccinated and hospitalized were in our older age groups, over the age of 60, who are also more likely to have comorbid conditions that may have caused them to require some hospitalization. But again, it's not translating into fatalities for those who have been fully vaccinated. And when we look at our case numbers for the percentage of those hospitalized, for example, the week of August 22nd, from August 15th to August 22nd, we had 732 cases. 17 of those, representing 2% of those cases, actually required hospitalizations. Now, as it relates to the Delta variant, again, not every positive test is getting sequenced, so it's tricky to know just exactly the full scope of the variant. We do get reports when there are samples that are sent to the state public health lab where they are sequenced. When they do come back positive for a variant, we do get reports on those. And I can say anecdotally from the emails that I've received at this point, not all of them, but nearly all of those cases that are coming back that have been sequenced from Montgomery County residents are showing the Delta variant.
I know we had talked about that before one-on-one. What are the complications there, I guess, in terms of the state the sequencing? Is it just they don't have the data? I'm curious what the hang up is there. Maybe hang up's not the right word, but what the challenges are there that you just described.
Well, it's a question of volume. There are special, the sequencing testing is more complicated and there are more steps involved in that as opposed to just doing a swab and running the test, whether you're doing it yourself versus others. And so there's multiple steps involved with that. And it's a lot trickier to scale up and do sequencing on 20,000 samples. That would be quite copious from a time perspective. So to answer your question, it's more intensive in terms of the steps involved, both in terms of the getting the samples, running the test, as well as the time involved in producing the results.
Thank you. And then Mark, I know you said September 18th is when weekly testing or COVID vaccines for employees can be required. In a recent memo your office sent to the county council, there were a lot of items that you said that were still being bargained with the employee union, mainly who's going to provide, the county's going to provide the testing, who's going to pay for costs, and then also if they're going to be able to get tested during working hours. Has that all been finalized, or is that still being bargained, I guess?
I'm pretty sure we're at the end of this. I think that's why we're announcing that what the deadline is going to be September 18th, and letting all the employees know that. So all the underlying issues have been resolved.
Can you provide any more? Will the county pay for the cost of the test? Can you provide any more details, I guess, on those issues I just mentioned?
Since I've been at the conference last week, I don't know what the final details of that are. But we can get somebody to talk to you about what wound up in there at the end of the day.
Thank you, sir. Thanks, everyone.
Thank you, Steve. I do not see any more requests for questions from members of the media. Going once, going twice.
Can I hop in with one question, Lorna?
Go ahead.
Thank you. Dr. McKnight, I'm sorry. Steve's questions got me thinking about how many questions I had about the MCPS staff vax mandate. Do we have a date by the time staff need to submit proof of vaccination? And then also the same kind of question that Steve had about if obtaining that testing, if you're not vaccinated, if that responsibility falls to the staff as far as cost and finding where to do it.
No, thank you, Caitlin. So we're working to communicate that with our staff next week. We really wanted to focus this week on having as many people participate in the fairs, the clinics, the pods that we have, to encourage them to get vaccinated. We are taking into consideration those who start participating in the onset of these particular vaccination clinics that are geared towards staff and students, the amount of time that it would take for them to be able to follow up on that and complete their vaccination process before we say this is our deadline in which we would have expected all of our staff. We are in discussions thinking mid to late September as well. So I can't give you that preliminary information. And by Friday, this week Friday, is when we required our staff to provide proof of vaccination as that validation has to occur to implement the system. So it's by this Friday that we've asked all of our staff to be able to upload and provide proof of their vaccination status.
Thank you. Thank you, Caitlin. Thank you, Dr. McKnight. No more questions?
Sorry. And I'm sorry, I did want to clarify. It's actually this Friday in which they have to notify us of their vaccination status. It's by the end of the month that they have to show proof. Yes, that's exactly it. Thank you.
Thank you for that clarification, Dr. McKnight. And thank you for joining us today. We will see you again next week. Have a great afternoon and be safe.
Thank you all.
Thank you.